Hello everybody, my name is Dr. Jonathan Kuttner. I work as a musculoskeletal and pain specialist, have done for many years. I do have a lot of experience in traditional Chinese acupuncture. I learned this about 30 years ago, actually studied it quite extensively and practiced using the principles of traditional Chinese acupuncture. Over the years also I have learned how to do dry needling, and what I'd like to talk about now, because there's a lot of confusion and there are people kind of drawing battle lines between acupuncture and dry needling. Having walked the walk with both, I'd like to just give my view on how it works, on the similarities and the differences, and there definitely are both of those similarities and differences. So both of these use needles, and the needle is the way that you effect a change in the body. If we take dry needling, the commonest points that people use when they dry needle are trigger points in muscles. So essentially, dry needling for most people is an accurate form of treatment of myofascial trigger points. There are extra dry needling points where tendons join into the bone. This is called an enthesis. And if you take, say, a tennis elbow or all the other tendinopathies, Achilles tendon and lateral hip joint tendinopathies, all these can also be treated with dry needling. Okay, the accuracy of placement of the needle is key. So if you are trying to look for a trigger point, you need to know how to examine, you need to know how to feel for where the trigger point, for the tight band, where the trigger point is, and you need to be able to place the needle accurately into the trigger point. And if you do so, there is something which we recognize as a twitch response, and the muscle will twitch. It's a completely it's not something under somebody's control. It's not a jump response as the person jumps. The actual muscle twitches as the needle touches the tiny little muscle spindles which live inside the trigger point in the muscle. It's a hyper-irritable area, and as it's touched, you get a reflex twitch. Okay, now that's traditional. If you are treating the enthesis, where the tendon comes in, the commonest way that this is treated with dry needling is what's called is a form of pecking, which is a traditional Chinese acupuncture way where you put in a number of little holes. In other words, you don't go in once, but you peck around, and by so doing, what you're doing is creating lots of little punctures, and you're hoping to stimulate a healing response. So this is dry needling, and it's dry because it's just a needle and you're not injecting anything through the needle. Now, acupuncture is a whole system that has been around for maybe 1,000, 1,500 years, or maybe even longer. And this uses, if you go to the traditional form of acupuncture, there is something called qi, which is a concept. It's a lovely concept, and this is the vital energy. It's there when you're alive, leaves when you're dead, and the qi flows in traditional Chinese acupuncture through meridians, which are like little rivers of flow, and the qi flows in a very particular way through each meridian. Some of the meridians are paired and so on and so. Okay, now along the line of each meridian there are a series of points. Now these points in traditional Chinese acupuncture have a local effect and a group of them have a distal effect. So if I take one meridian, and there's, say, the large intestine meridian. Large intestine meridian starts down in my hand, it runs up my arm with numbered points, starting from large intestine 1, 2, 3, 4, very important point, and each of these has a Chinese name. So this one is large intestine 4, Hoku is its Chinese name, and then you move up 9, 10, 11, also very important points, and then runs up and it ends up on my top lip. Okay, now if I have face pain, using traditional Chinese acupuncture, I would treat with a local point or two, but I would go down to Li4, which is on that meridian and is well known to cause pain relief all the way along the meridian, especially at the end. If you had the stomach meridian, which begins right up here and ends up down in your foot, if you have a headache, you can put a needle in between two of the toes, which is stomach 44, and you will get a pain relieving effect up here. This is traditional Chinese principles, and so if you look at the two ways of treating the human body, the dry needling is what's called barefoot doctor level. And this was when Mao Zedong was had kind of, and his crew had hijacked China. That's a political statement. When Mao Zedong had taken over, there was the Cultural Revolution. Part of it was to create a whole cadre, and I think there were 1 million people that were trained, and they were the barefoot doctors. They went out into the community, and what they were trained was to look for the sore areas and put needles into them. So this is essentially dry needling. It may be that they learnt a few of the other points, but not many of them. So most of Western needling is at the level of of barefoot doctor treatments. There are other levels for acupuncture. Acupuncture can get more and more subtle, and you can use very specific points to treat blood pressure, and you use points to treat all the ills of the human body. How effective that is something that's up for discussion, and how effective it is actually now really becoming pretty plain that the use of traditional acupuncture in most of China is shrinking, except for treatment of pain and pain-related conditions, where it is definitely, and there's no doubt at all, it is very, very useful. So the similarities are that they both use needles. The similarities are that virtually every point that's used in dry needling is an acupuncture point, and that the acupuncture points that are used are trigger points. So the acupuncture points weren't sucked out of people's thumbs and made up. They were, in fact, the areas that were in spasm causing trigger points, plus a whole raft of other points which have a lot of other uses. So, as I said, you can treat, and there are a whole lot of other strange variations in acupuncture. You have ear acupuncture, where the human body is represented on the ear, or you can have the acupuncture only on your hand, or you can have acupuncture only on your foot. So there are all these systems within systems. But if we leave all those aside, essentially dry needling is treatment at a low level of acupuncture, but it is very accurate and excellent treatment of chronic musculoskeletal pain. And so it's taken that part of traditional acupuncture, and it's using it very effectively and very efficiently. And as I said, in China now, because people vote with their feet, the use of acupuncture for all the other treatments is shrinking, and the use for pain is growing. So things are kind of converging together. There's no huge, massive differences. So this is my take. I know that there are people who are really passionate about acupuncture, and in fact, I was and still am really passionate about acupuncture. And people who say, well, dry needling is not acupuncture. To those people, I actually don't agree at all. I think that, as I said before, they're just two takes on, they're two sort of slightly disparate approaches treating similar or the same parts of the human body, and getting, both of them, getting predictable and excellent results in treatment of chronic pain. Thank you.